Diagnosis of borderline personality disorder, BPD, difference between formal diagnosis and misdiagnosis. Diagnosing borderline personality disorder, BPD, is a complex and nuanced process that requires careful clinical assessment. However, despite the clear diagnostic criteria established in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, BPD is often misdiagnosed due to its overlapping symptoms with other mental health conditions and the negative stigma that has historically surrounded the disorder. In this episode of the Borderline Personality Disorder, BPD, podcast, we will explore the difference between a formal diagnosis of BPD and misdiagnosis, discussing the challenges involved in identifying BPD accurately and the consequences of misdiagnosing this complex condition. Understanding formal diagnosis of BPD. A formal diagnosis of borderline personality disorder is made when a mental health professional, such as a psychiatrist, psychologist, or clinical social worker, determines that an individual meets the diagnostic criteria outlined in the DSM-5. According to the DSM-5, a person must exhibit at least 5 of the 9 specific symptoms associated with BPD, which include emotional instability, impulsivity, a fear of abandonment, unstable relationships, chronic feelings of emptiness, and self-destructive behaviors, among others. To make this diagnosis, a clinician typically conducts an in-depth clinical interview and may use self-report questionnaires, structured interviews, and observational methods to assess the individual's emotional and behavioral patterns over time. The clinician will also need to take into account the person's life history, including any trauma or early life experiences, as these often play a significant role in the development of BPD. Challenges in diagnosing BPD. Diagnosing BPD can be challenging for several reasons, many of which relate to the nature of the disorder itself. Some of the difficulties in diagnosing BPD include: 1. Symptom overlap with other disorders. BPD shares symptoms with a wide range of other mental health conditions, making it easy to confuse with other disorders. For example, individuals with depression, anxiety disorders, post-traumatic stress disorder, PTSD, or bipolar disorder can experience emotional instability, relationship difficulties, and impulsivity, which are also key features of BPD. These overlapping symptoms can make it difficult for clinicians to accurately differentiate BPD from other conditions, especially in the early stages of diagnosis. 2. Varying presentations of BPD. BPD does not present in the same way for every individual. While emotional dysregulation, impulsivity, and unstable relationships are common features of BPD, the severity and manifestation of these symptoms can vary greatly from one person to another. For example, some individuals may exhibit more internalizing behaviors, such as self-harm and depression, while others may show more externalizing behaviors, such as anger outbursts or reckless actions. This variability can make the disorder harder to recognize, especially in cases where the individual does not exhibit the classic outward signs of emotional instability. 3. Stigma and misunderstanding. Historically, individuals with BPD have been stigmatized and labeled as manipulative or attention-seeking, due to their intense emotional reactions and impulsive behaviors. This negative perception has made it difficult for clinicians to approach the diagnosis with an open mind. As a result, some individuals may be dismissed or misdiagnosed because their behaviors are misunderstood or viewed through a biased lens. In many cases, this stigma has led to misdiagnosis or delayed diagnosis, further complicating treatment. 4. Co-occurring disorders. Many individuals with BPD have other co-occurring mental health conditions, such as depression, anxiety disorders, or substance use disorders. These conditions can further complicate the diagnostic process, as the symptoms of these other disorders may overshadow the core features of BPD. For example, a person with BPD may also have an anxiety disorder, leading to an emphasis on anxiety-related symptoms rather than the emotional instability characteristic of BPD. The consequences of misdiagnosis. A misdiagnosis occurs when a mental health professional inaccurately identifies a disorder or attributes symptoms to a condition that does not fully explain the individual's experience. In the case of BPD, Misdiagnosis can have significant consequences for both the individual and their treatment. 1. Incorrect treatment plan. A misdiagnosis of BPD can result in inappropriate treatments that fail to address the person's true needs. For example, if a clinician mistakenly diagnoses BPD as major depressive disorder, MDD, the person may be prescribed antidepressants without receiving the appropriate therapy for emotional dysregulation and interpersonal issues. This can lead to ineffective treatment and prolonged suffering for the individual. On the other hand, misdiagnosing BPD as bipolar disorder could lead to an overemphasis on medication for mood stabilization, when therapy, for example, dialectical behavior therapy, DBT, might be more beneficial. 2. Delay in proper diagnosis and treatment. Misdiagnosis can delay the correct identification of BPD, which means the person may go without the appropriate treatment for years. This delay can worsen the symptoms of BPD, potentially leading to chronic emotional pain, instability in relationships, self-destructive behaviors, and even suicidal tendencies. When the correct diagnosis is eventually made, the individual may have endured unnecessary suffering, with the added frustration of having their struggles misunderstood or dismissed in the past. 3. Increased stigma. Misdiagnosis can also contribute to increased stigma surrounding BPD, both for the individual and for others living with the disorder. If BPD is misdiagnosed as narcissistic personality disorder, NPD, or antisocial personality disorder, ASPD, the person may be unfairly labeled as manipulative or dangerous, reinforcing the negative stereotypes often associated with BPD. This can affect how they are treated by others, including family members, friends, and healthcare providers. 4. Frustration and loss of trust. When individuals are misdiagnosed, they may feel frustrated, misunderstood, and helpless. The wrong diagnosis can result in a sense of losing hope that they will ever receive the right kind of care. Over time, individuals may lose trust in mental health professionals, making them less likely to seek help in the future. Misdiagnosis, especially when it leads to ineffective or harmful treatment, can perpetuate a cycle of mistrust in the mental health care system. Common misdiagnoses for BPD. Some of the most common misdiagnoses for borderline personality disorder include: 1. Major depressive disorder, MDD. BPD can sometimes be mistaken for depression, especially when the individual presents with intense sadness, feelings of emptiness, and low self-esteem. However, depression is typically more stable and less reactive to external triggers than BPD. BPD is also characterized by impulsivity, relationship instability, and extreme emotional swings, which are not present in MDD. 2. Bipolar disorder. BPD is often misdiagnosed as bipolar disorder because both conditions involve mood swings and emotional dysregulation. However, the mood shifts in BPD are often much shorter in duration and are typically triggered by interpersonal stressors. In contrast, bipolar disorder involves more extreme shifts in mood, lasting for days, weeks, or even longer. 3. Post-traumatic stress disorder, PTSD. Both BPD and PTSD involve emotional distress that stems from past trauma. However, PTSD is specifically related to traumatic experiences, while BPD is characterized by ongoing instability in emotional regulation, relationships, and self-image, regardless of trauma. Additionally, BPD involves interpersonal dysfunction and self-destructive behavior, which is less common in PTSD. 4. Narcissistic personality disorder, NPD. NPD and BPD share traits such as emotional dysregulation and instability in relationships, but they differ in core motivations. People with NPD tend to have grandiose self-views and seek admiration from others, while those with BPD struggle with fear of abandonment and have difficulty maintaining a stable sense of self. Conclusion. The diagnosis of borderline personality disorder, BPD, requires careful assessment, clinical interviews, and a thorough understanding of the individual's history and symptoms. The distinction between formal diagnosis and misdiagnosis is crucial because an accurate diagnosis leads to the right treatment and better outcomes. Misdiagnosis can lead to delayed treatment, ineffective care, and increased stigma, all of which can negatively impact the individual's well-being. In future episodes, we will continue to explore how BPD is diagnosed, treated, and understood, shedding light on the complexities of this often misunderstood disorder. Stay tuned for more insightful discussions on borderline personality disorder.